everyone. Today we're going to have an interesting topic, an intimate topic, because this is a topic that most women don't talk about, and we don't talk about it to our spouses, our partners. We don't talk about it to our friends either. Sometimes we bring it up with our gynae or lady doctor. But I found that this is something that is very common, and yet many do not know what to do, what's happening, and don't know what it's all about. Now, you all must be wondering why the title is called MonaLisa. So before we start, I'm Dr. Sutina. I am the Medical Director of Enhanze Webinar. Some of you may already know me. During this MCO period, we decided to have a series of webinars, especially tackling intimate subjects. Last week, we talked about female urinary incontinence. This week, today, we're going to talk about the MonaLisa Touch, which you all are going to be wondering, what is this MonaLisa Touch? I mean, everybody knows about Mona Lisa being the famous lady, artwork by Leonardo da Vinci, but this is the MonaLisa Touch, okay? Why we're talking about this? Because MonaLisa Touch is a condition that is helping a lot of menopause women going through hormonal changes, and about 75% of these postmenopausal women suffer from something called vaginal atrophy. So let's go through to explain to you, and so that you understand a bit more what vaginal atrophy and all the changes that a woman go through when they go through menopause. So as you know, we women, we age, everybody else age, and as we age, what happens is our body also changes. Now, the changes don't just occur in our face and our body externally, but it also occurs internally. Now, women go through a lot more changes internally, externally than men do, just because we get a lot of physical things that go on, like childbirth and hormone changes that occur. And so aging process actually affects women a lot more, I feel, than men. And what's the most significant aging thing that happens is menopause. We all go through it sooner or later, and we have to understand how it is, what it is, and how to tackle it. What is menopause? Menopause is a point when our menstrual cycles actually permanently ceases. And to diagnose this, usually we accept 12 months or sometimes even 6 months cessation of period, meaning you have no period at all for 6 months to 12 months. And this marks the start of menopause. Okay, so it marks the permanent end of our fertility. And so for women in menopause, we are not fertile anymore, meaning we cannot reproduce anymore. The average age of menopause is 51, but it ranges. So here you see a chart that shows what happens initially in the first 2 to 5 years of a woman's pre-menopause, between the age of about late 30s, 38 to 45. We go through the transition period, and this is where some changes occur already in the body. Not severe yet, and then the period becomes erratic until it stops entirely, totally, and that's when the point of menopause occurs. So we have, this whole period is called perimenopause. It can be as fast as 2 years, or it can be as long as 5 years. And once postmenopause occurs, a lot of changes start to occur. Now, these changes, these symptoms can occur during the peri stage in mild form. It gets worse as time goes on, and it can be quite severe for some people. Women start to experience hair loss. A lot of women that come to see me, they will then tell me that, you know, their hair is thinning, getting more rough, and, you know, they see more hair on the floor. Their skin gets dry, it's itchy, you have hot flushes, the night sweats is quite bad, you can't sleep well at night, sometimes breast pain, irregular heartbeat, lots of digestive problem. Loss of libido is a pretty common thing, but usually occur a little bit later in menopause. Of course, the menstrual periods become erratic, eyesight sometimes not as good, knees feel weak, nails look brittle, easily break, and you know, doesn't look as nice and shiny, and of course frequent urination with urinary pain. The most common symptoms are usually fatigue, just feeling tired, dizzy, irritable, headaches, get mood swings, and can't sleep well at night, and sometimes even memory lapses, but what we call as foggy mind. Now, why does this happen? It's really because of our hormones, and the hormones that's most affected in menopause is the female hormones, which is our estrogen and progesterone. But don't forget, apart from the female hormones, we also have male sex hormones, which a lot of people are surprised to know. But this is also two important sex hormones in us. Of course, not as much as the ones in men, but testosterone is also, and DHA are also present, and this also reduces, and this is what affects the libido, right? The sexual urges become less. So the most important hormone in a woman is estrogen, and as we have the highest peak of estrogen in our body at the age of 18. At puberty, we get the surge, and then it stays up until the age of about mid-20s. The levels are quite high. It starts to deteriorate by the time we are in our 30s, and by the time you are 50, the amount of estrogen in the body has gone down by half. Okay, so this, of course, varies woman to woman. One way to see when your menopause could occur is by looking at your mother, and usually an older sister, and usually it's around the same age that occurs to our moms. Okay, and as you can see, by the time 50 it's half, but by the time you're 60, it's about 1/3 only. So you can imagine what sort of feelings, sensations, and changes that the body would go through due to this massive drop in estrogen level, which is our main female hormone. So what happens? What happens when the symptom, low estrogen is low? Of course, there is sexual intercourse becomes uncomfortable because there's less vaginal lubrication, and so many women after menopause complain to me that sex is painful. There's an increase in urinary tract infections. In fact, in my house alone, my helper is a lady of 60 over, and she gets a frequent urinary tract infections almost every month. It's quite a bothering and uncomfortable situation for her. So it can be very bothersome. Irregular absent periods, mood swings, hot flashes, breast tenderness, headaches, depression, all these are part of menopause, but somehow it's quite easy or possible to tackle. I think the two most difficult ones to tackle is the pain and the urinary symptoms. Yeah. So why does it affect it? So this is a cross-section of a diagram of our female, not pelvic muscles, but reproductive system. Now it really affects mainly this area, because these are what we call the hormone or estrogen sensitive area in the body, apart from the breast, where a lot of receptors to estrogen is here, right? So this is the uterus, this is the vagina. In front of the vagina is the bladder, and the urethra, which is tube for the urine. So a lot of times, because estrogen is partly produced by the ovaries as well, it affects the uterus and mainly the. Okay. So what do we get? What all this effect on the genitals is called genitourinary syndrome, or GUM. So what happens? You get vaginal atrophy, vaginal relaxation syndrome, vaginal laxity, sexual dysfunction, some urinary incontinence, and even prolapse of the pelvic organs. Yeah. So vaginal atrophy, in simple terms, is dryness, itching, pain, or irritation during menopause. Now, a lot of women go through this. About 80% of menopause women will suffer of this. So what is vaginal atrophy again? The medical term we use is atrophic vaginitis. Vagina is, as you know, is our vagina. Atrophy is actually thinning, or in Malay it's called pengecutan, or drying up. So atrophy is drying out of the area. So atrophic vaginitis is thinning, drying, and inflammation of the vaginal walls, and this is due to having less estrogen. it most often occurs after menopause. Okay, so you can see here the difference between a healthy vagina of a 20, 30-year-old woman and an atrophic vagina. You can see how first the ovary has shrunk in size, the fallopian tube has also shrunk, right? Because again, Mother Nature says we don't need to reproduce anymore, so there's no need for estrogen. So everything shrinks. And you see the walls of the uterus, this is the wall of the uterus, see how much thicker it is. After atrophy, it becomes about half the thickness. The vagina wall has a lot of, folds, what we call rugae. This is for folds and it's nice and pink, whereas when atrophy occurs, it's thinned out and more flat. Yeah, you can see here how thick, with lots of blood vessels going to the surface, and the thickness of the mucosa is nice and thick, and so produces a lot of lubrication and is also elastic. Whereas after atrophy, after menopause, it thins out. There's no more folds like a healthy young vagina, less blood circulation going there, and so there's more dryness and pain when the sexual intercourse occurs. Okay, so this is a simple illustration of how the vagina walls look. So you can imagine from here, which is a 20-something vagina wall mucosa, it's gone down to almost 1/3 of what was before, right? And the surface, it's nice and plump, whereas it's flat and dry. So just like our facial skin, as we age, it dries out. With less estrogen, it dries out, thins out, and becomes more lax. It's the same thing that happens in our vagina wall as well. So what happens when vagina atrophy occurs? There's dryness, burning sensation, definitely dryness and burning sensation because of the inflammation that's going on. There's a lot of burning sensation that's felt, even in normal times. There could be some vaginal discharge, which is not a healthy sign, and because of the imbalance of the good bacteria in the vagina. So that's why for women, older women, it's very important to make sure you have your probiotics, your prebiotics, and if possible, you can get that from yogurt, probiotics and prebiotics, and that will help to balance the microflora in the vagina. There is genital itching. Because of the dryness, you feel quite itchy. And when there's itchiness and thinning of the skin, and urination causes a burning sensation because there's also thinning of the urethra or the outlet outlet of the bladder walls. Burning with urination urgency, that means you have this urgency to urinate, you can't hold back your urination. There's also, because of the thinning of the walls, there's frequent urinary tract infections. There's changes in the cellular makeup of the area, so infections easily occur. And yes, like we spoke last week, there's some incontinence as well. Some patients even have some spotting or slight bleeding after intercourse because of the really thin out area, and it becomes painful. There's a lot of discomfort, it's painful because it's dry, and so there's less activity, and slowly the vaginal canal shrinks, and so we call it shortening of the vagina, making it even more uncomfortable during sexual activity. So it has been found that about 75% of women reports vaginal atrophy, and this impacts their life a lot, right? Many of us just suffer in silence, and you just go through it, don't know whether we can get help or not. We accept it as part of aging, part of something that happens as we age, and we just learn to live with it and suffer in silence, which you don't have to, because there are remedies out there now that is safe and effective to do. Yeah. So now, why does the decline in estrogen causes vaginal atrophy? And it's really because the vaginal tissue becomes less elastic, and then once it's less elastic, it becomes more fragile and therefore easily injured. Are there other causes of a decline in estrogen in women apart from menopause? Yes, there are. So menopause is the main cause, is the main reason, and most of the time atrophic vaginitis occur in menopausal women. But other women, younger women, can also have atrophic vaginitis. For example, during breastfeeding. During this time, it is Mother Nature's way to protect the body. And so when women are breastfeeding, they actually, there's actually a decline of estrogen. They don't have atrophic vaginitis, but there is a decline in their estrogen levels, okay? After removal of ovaries, what we call surgical menopause, because the main producer of estrogen in our body is from our ovaries, and therefore we need both our ovaries. After chemotherapy, treatment of cancer, whereby it affects the reproductive system and ovaries. If there's pelvic radiation, as in radiotherapy for any cancer in the pelvic region, uterine cancer, hormonal treatment that is used for cancer treatment, and all these can cause a reduction in estrogen in the body. Now, lower estrogen will then reduce the blood supply to the female reproductive system. It is the the key center for sexual pleasure in most women. So because there's lower blood circulation, there's also less sensitivity in this area. So women can actually feel there's a difference in their sensitive level from an earlier stage. Okay. In order to overcome this, it's important to have regular sexual activity because it keeps the blood circulation going. It keeps blood circulation not just to the pubic area and to the reproductive system, but it also gets the heart pumping, which makes the whole blood circulation better. So the vaginal tissues then will remain healthy. So you know what they say, regular sexuality makes you live longer. Okay, so that's something good that we can do to actually have a longer life. And okay, so the lack of circulation also makes for reduction in the sensation, which means the sensitivity during sexual activity is also reduced, which affects orgasm, which may be less intense and takes longer to achieve, which affects the lifestyle of women. So all this, in terms of lower estrogen, affects everything around the area. Okay. Now, did you know that when women who have vaginal atrophy, about 50% of women after menopause also suffer from stress urinary incontinence? So that's another thing, because as you saw in the diagram earlier, the urethra is just in front of our vagina. So when the vagina thins out, there is also thinning of the urethra, and so there will be some changes in the area causing stress urinary incontinence. Okay, so in a study that was done, in a survey that was done by Viva, it was found that dryness occurred in about 75% of women. Dyspareunia is pain during sexual intercourse, occurs in 38% of women. Vaginal itching, discharge, and pain is around 15% of women, while urinary symptoms like pain during urination, urinating at night, urgency in urination, urinary incontinence, recurrent urinary tract infections, all occur in vaginal atrophy. Okay. 2 out of every woman would have urinary incontinence. What is urinary incontinence? This is the involuntary leakage of urine. It means that you can't control your urinary sphincter. When does it happen? For stress urinary incontinence, usually when you cough, when you sneeze, you laugh, you stand up, get out of a car, when you lift something heavy, exercising, and even having sex, right? So who are the women who are likely to get vaginal atrophy and all the other symptoms related to postmenopause? women who has never had vaginal birth, meaning women who's never given birth through their vagina, so they has. So these women actually have a higher risk of getting vaginal atrophy as compared to those women who delivered via their vagina, who had vaginal delivery. Women who smoke, because cigarette smoking actually affects the blood circulation, reduces the oxygen supply to the area, and so this makes them more at risk of higher chance of getting atrophy. And of course, women who are celibate, who do not have sexual activity at all. And this has been found to be very common among like those nuns in Europe, and and of course, people who's never had any sexual activity for whatever reason. Okay, this does not allow blood circulation to go to the vagina area, and so the tissues become, with time, the tissues become less elastic. This is one state where we say the more you use, the better it is. So you need to use it. So how do we know? Well, you need to see your doctor. You need to come and see a doctor, and then of course you have to see symptoms. Once you have the symptoms, you can suspect in your menopause it to happen, and then on examination, what is normal, what I would see is a pale, small, shiny vaginal lining. These are the things that I would see. Okay, it looks pubic hair has become sparse, it's less. The external genitalia stretching is there's a lot of excess skin out there. We can see blood vessels like this. This shows there's inflammation on the vaginal wall, and sometimes even the vagina coming out, so like a pelvic organ prolapse. I'll show you a picture of that. See, you can see the vagina actually introitus. This is called the introitus, which is the opening of our, you can see the wall of the vagina here, right? This means that there's a bit of prolapse because of the weakened walls. Here, this is a diagram how it happens. There's a bit of a, sometimes even the rectum can move down because of the weaker support. Okay, what tests can we do? I do hormone tests first to check your estrogen or your 4 important hormones, confirm and you have the symptoms. It sort of confirms clinically, but it's good to have a blood test just to make sure that, to have an objective sort of view of, treatments, what we do is it could be systemic and it could be local. So it means overall, of course, we need to replenish the hormone that's dropped, because no matter what, it is due to the drop in estrogen and the other hormones. So into systemic hormone therapy for overall improvement, and then we go to the local area of the vagina and external genitalia to improve the local area. So the treatments for menopause is mainly with estrogen. This would be estrogen to relieve the symptoms of menopause. They could come in the form of a peel, skin patch. Okay, my personal favorite is as an anti-aging physician, I go for bioidentical hormone therapy. There are some doctors not advocating it, but we are for bioidentical. Now, what is bioidentical hormone therapy? It is a treatment to treat the hormone imbalance in us, in you, which could include progesterone, estrogen. Okay, what it is, it's actually biologically identical to our body's existing hormones. So it's natural occurring. Most of the time it is made from plants, phyto. For example, in the case of progesterone, it's made from yam. Or sometimes it is lab formulated, but it is formulated exactly like the body's natural hormone molecule. So it's called bioidentical because it's identical to it doesn't take over the body, the body's function. It only comes in to optimize the already lowered levels in the body. Okay. Locally, we can have vaginal moisturizers like liquid beads. There's a lot available in the market. You can use KY jelly to moisturize the vagina area. Our personal favorite we use in the clinic is actually PK24. There's water-based lubricants that can be used just before intercourse occurs, and there are some topical vaginal estrogen creams or gels that can be inserted into the vagina to help with increase and improving blood circulation, bloodstream. Okay. Now, again, I just want to show you the picture of the cross-section. Okay, what happens? This is cross-section and this is what happens. Thicker vagina, thicker uterine lining, endometrium, and thinner vagina wall, right? Sorry. So, the treatment of vaginal atrophy uses the water-based glycerin, and of course, when you use a vaginal moisturizers, you need to use it regularly and frequently. Okay, this relieves the symptoms and makes you feel a bit more comfortable. Now, what about vaginal rejuvenation procedures? Now we come to the part of the MonaLisa. For the longest time, women had suffered from these symptoms since time immemorial. There was really nothing to be done, just accept it. It's part of aging. And anyway, these women has gotten older, they've got their grandchildren, so they just focus on other things in life and not on themselves, and accept it as body changes. But then when HRT was discovered, we knew that it was partly estrogen and hormones, so we take that. But the local effect, the thinning is still there. It's still not that much better. All the topical creams and lubricants that we're using is only for a short-term measure. So really there was a gap, and there was something that was really, really needed in the community to help women with reducing the symptoms and overcoming the symptoms, or even reversing the condition to make them, because women are much more productive now. Even at 50, 60, they are still, you know, active, traveling, good relationship with their spouses or their partners, and they want to feel good about themselves. So the advent of procedures, because there's no surgery for vaginal atrophy anyway, so it's either that and suffer. So there's really this gap that is unmet need, and so the advent of vaginal procedures came in. Okay, so non-surgical method, the laser treatments came in, which then the concept is if we could heat up the tissues in the vagina area, which already thins out just like the facial skin, and stimulate there, and thus cause the vagina to become tighter and taut. So if we can do that onto the facial skin, why can't we do it for the vaginal mucous membrane? So the first laser that was created to do this was a CO2 laser, and that was when the by Deca, and that was when the MonaLisa Touch came in. So this is a breakthrough non-surgical, non-hormonal vaginal rejuvenation laser treatment that treats itching, burning, painful intercourse, and vaginal laxity. Yeah. So what is the MonaLisa? Well, it's called the MonaLisa Touch because it is the first intravaginal laser treatment. So it's a touch. Just like MonaLisa wants to look pretty, smile, so the vagina area is like, because the laser, actually why they call it MonaLisa is because the laser is by Deca, and Deca is a prominent laser company in Italy. And Deca's head office is actually in Florence, Italy, where the museum, where MonaLisa is actually in the Louvre, but where Leonardo da Vinci was lived. So that's how it's called MonaLisa. Okay, it's a touch because it goes into the vagina. So it's the first intravaginal laser treatment against menopause disorders. It is minimally invasive, but it is a permanent method and permanent result that's achieved. Okay, and it's done for internal and external female genitalia. So the laser probe is actually inserted into the vagina here, right, to actually shoot the laser. We had the initial, when it was first created in 2012, we had the prototype and I tried it out. It was a big probe that I had to go. It was quite uncomfortable until later, because they gave it to a few Asian clinics, and we were, I think our clinic was the first clinic the only clinic at that time, and they were trying it out in all the Asian countries, Singapore, Malaysia. So our clinic, they gave it to me to try it out first so that we could give them feedback. And the first probe was quite big, and then later they came out with this much better, because they wanted to try it out for Asian women, and then the different types of Asian women, South American, African, and then European, and whether there's a difference in the length of the vagina and the comfort level. So this was, so later they came out with this very comfortable cylindrical handpiece that goes into the vagina to shoot the laser. It is painless. It is considered minimally invasive because there's no cut, there's no cut or any, well, basically any cutting that occur. It just acts on the vaginal mucosa and therefore stimulates the production of collagen. By improving the collagen production, the functionality of the treated area is improved. It restores the trophic balance of the mucous membrane. Okay, so the vagina, the probe is inserted into here, and so what happens, this is before, where it's all thinned out and it looks quite wide, the vagina opening, with thickening of the walls and shrinking of the tissues, it becomes tighter. So the treatment with MonaLisa Touch can actually reverse the condition related to menopause-related vaginal atrophy. And since we've been doing this, we've been conducting this treatment since 2014, 2015. I've done quite a number of patients. It's amazing how some of them even come back and tell me they don't need, I mean, they can really feel their sexual relation improve. And although we recommend 3 times, many of them sometimes do once or twice and they already feel better. Now, initially, we didn't think it could help to tighten the vaginal walls, but now we realize it can. So we do find that in younger women, although I had some women, younger women who didn't have vaginal atrophy but wanted to try, and because there was no other solutions available, there were no other lasers. Now there are quite a few, but there's no other lasers or devices available to help tighten. These women didn't want to go for surgery and they didn't think they need surgery, but they needed something to help tighten their stretched vaginal tissues. So we tried this out and it actually did help to actually reduce the vaginal laxity in women. Okay, how long does the treatment take? It actually takes only about 10 to 15 minutes internally, but because changes also occur externally, I do treat external as well. We treat internal and external, but external because there are a lot of nerve endings, so it's a bit uncomfortable. We need to apply some numbing cream, and this numbing takes about 20 to 30 minutes to complete. So the handpiece is then inserted here into the vagina, okay, gently. And then once it's inserted, the laser is released. You can see the laser light, right? I recommend that you do not have sexual intercourse for at least 3 days because there is some thermal injury here to allow it to heal. But over the next 72 hours, the tissues regenerate, collagen regenerate, and then after about 2 weeks, you will feel firmer and tighter. Okay, this is how the laser looks like, and in a pathologic study, cross-section biopsy, what was taken, and it was shown that an atrophic vagina like this, this is after 7 days, I think, there's a thickening of the mucosa wall. Okay, so here again the histological result. You see how thin it is, and how the cells here are all fibrous cells, okay? So thin, and after 2 months, see how much thicker it's gone from here to here, okay? This is 2 weeks post-second treatment, and the rugae is more. So we reverse the condition to almost a younger, nearer to the younger condition. So a woman can actually have a bit of reversal of the condition. Okay, I won't show this. So again, cross section, you can see the probe goes in, there's thickening, and thus there's tightening as well. Possible side effects, I'm sure you're asking me now, what are the side effects? Well, during the procedure, maybe a little bit uncomfortable because, you know, when the vaginal wall is so thin, it's already painful to have intercourse. It's already painful to even put a finger. Although the probe is actually quite narrow, it can be a little bit uncomfortable. So we use a lot of lubrication. They need to be numbing cream outside because our outer part can be a little bit sensitive. Immediately after, there could be some spotting, of because of the laser. This is a CO2 laser, so it goes quite deep. And if the walls are so thin, there could be some spotting. We will warn you about that. Sometimes some people have a bit of vaginal bleeding the day after. This just shows how thin the vaginal wall is. Sometimes some vaginal discharge. You could have some fungal infection, which is why I will recommend that you take some antifungal immediately after treatment. Swelling, inflammation, tenderness, some itching, irritation, of course burning sensation during urination, because remember we've ablated a bit of the area. Okay, but all these are short term. It just goes away after a few days. So MonaLisa Touch is a 3-treatment procedure that lasts less than 5 minutes. It's in office with no anesthesia. It is a breakthrough, and it is something that we all should consider if you have vaginal atrophy, because it really does amazing results. That's all for now. Thank you. For any questions, if there's any questions, you can ask me now. You can call me and have a personal one-on-one through the numbers here. You can snap the picture here, or email to me at this email, at my email, and we can have a one-on-one private conversation about any condition that you may want to clarify. Oh, someone's asking a question. I read you have a machine which tightens the vaginal wall. Can you tell me more? I think I just went through that. That's called the MonaLisa Touch. It's a laser. It's the first of its kind, and it's the only FDA-approved laser for vaginal atrophicity. Okay. How do I stop getting acne in my pubic area? I think keep it clean, wash your pubic area often. I've had some women ask me about, not acne, it's actually infection of the follicles, of the hair follicles. And this usually occurs in women who shave themselves in the pelvic area. When they shave, what happens is that either the shaver is not clean, and so you get bacterial infection into the hair follicles, which is called folliculitis, and this looks like small pimples. Okay, or sometimes you get ingrown hair. Ingrown hair will make your will become swollen and can get infected. So that is so try not, if you do need to shave, yes you can, but I do recommend that people go for laser hair removal in the pubic area if they like it clean down there, and do that, because after all, if you do it 2 or 3 times or even up to 4 times, it's permanently gone, the hair, and you don't need to shave again. And then it also makes your skin lighter, so it looks, it's better, and you don't get this acne in that area. Any more questions, anyone? Well, are we okay? Are we good? So I hope you join us again next 2 weeks on the 16th. We're going to talk about vaginal laxity. This is a series on intimate health. We'll talk about vaginal laxity. I'll talk to you about when I'll share with you what vaginal laxity is, how it happens, and what we can do about it. This is also another very common problem, usually in the younger age group. So let's see how it is, and please do join me then. So all for now, bye.